So, yes.
Okay. All right, we're live.
Great. I see a number of people trickling into the meeting room. Welcome to the May Global Digital Health Network meeting. We're going to give it a few minutes for people to join the line. We'll leave this slide up to get you excited about our upcoming presentation. Great. If you've just joined the line, welcome to the May Global Digital Health Network meeting. We're giving it just a few minutes, probably one more minute for people to join the line and get situated, and we'll get started. Good morning, good afternoon, good evening, depending where you are in the world. Welcome to the May Global Digital Health Network meeting. Before we get started with the presentation for this month, which you can hopefully see on your screens now, we'll make just a few brief announcements. First and foremost being that our call for abstracts is open for the 2020 Global Digital Health Forum. It's open until July 2nd, and this year's theme is digital health, making it work for everyone. We've also recently partnered with the Network of Networks. That's a group of regional digital health networks to compile some tips for successful abstract submission, particularly for those who perhaps have never had a submission to the Global Digital Health Forum before. You can find those on our website and our conference submission platform, which we'll share the links to in the chat. The forum is currently scheduled for an in-person meeting as usual or an in-person conference as usual in December, but we are of course monitoring the current situation and keeping our virtual conference options open. And finally, if you've joined this meeting from a forward from a colleague, you can join our listserv through our website. We'll be putting the link for that in the chat as well. My name is Lauren Wall. I'm a co-chair of the Global Digital Health Network along with Steve Allis and Christina Villela. And speaking of Christina, she is also one of our panelists today for our May webinar from Measure Evaluation and ICF, presenting on an assessment tool and SOPs for developing for EHR security. We will hear from our panelists, and while they are presenting, you can use the Q&A feature through Zoom to populate questions. And we have plenty of time for questions at the end. So I'd like to introduce our speakers this morning, afternoon, or evening, depending where you are. We have Sam Wambugu, who's a health informatics expert with 20 years of experience supporting countries across Africa to improve health information systems. He is currently the health informatics advisor for Measure Evaluation and the ICF team lead for the Measure Evaluation project. Mr. Wambugu has a special interest in information systems interoperability, data ethics, data analytics, as well as information systems security and governance. Welcome, Sam. Olivia Velez is a senior health informatics specialist with Measure Evaluation ICF, who has over 20 years experience working in health information technology and has completed training in computer science, public health, nursing, and biomedical informatics. Her work is focused on the use of informatics to address community health challenges and global health disparities. Welcome, Olivia. Ana Ngaruro is a Project Management Institute certified project management professional and a certified information systems security professional with 20 years of experience developing and supporting health information systems. Ms. Ngaruro is the Data Exchange and Interoperability Group Lead for PEPFAR's information systems, including DATUM. And Christina Villela is a lead health informatics specialist with Measure Evaluation ICF. Ms. Villela has extensive experience in health informatics, health information systems, project management, and program evaluation. She co-managed the health informatics portfolio under Measure, serves as an HIS subject matter expert for the Datum Exchange and Interoperability team, and is certified in the Open Group Architecture Framework, TOGAF. So as we hand it over to our colleagues from ICF, a reminder that you can use the Q&A function in Zoom to populate your questions that we will have our panelists answer at the end. So without any further ado, I'd like to hand it over to our colleagues from ICF.
Thank you, Lauren, and hello, everyone. Let me see, this is moving. Okay, so in today's agenda, we will strive to achieve two things. One is to share the overview of security assessment tools. So the whole presentation is about information system security and the assessment that we carried out recently. And so in doing that, we'll also share standard operating procedures for implementing electronic health record security. And then, as Lauren has said, at the end of this presentation, we will handle questions that as we go along, we'll be putting them on the chat box for our response at the end. But first, why electronic health records? Why are we particular in putting time and effort in looking at electronic health records? For a long time, mainly in low and middle income countries, the data that we have reported is mainly aggregate, whereas it has served its purpose for a long time. The intention of patient monitoring, the need to conduct patient monitoring is not satisfied when we are using aggregated data. And so in the increased demand for patient level monitoring, including for responding to goals such as 95, 95, 95, requires that we use electronic health records so that we can get patient level data for that purpose. Then there is the double burden of disease that requires complex clinical decision making. When a patient presents themselves to a clinician, they often had other underlying condition or other health challenges, and the clinician has a better chance of solving those ones when he or she can look at the past records. Therefore, the electronic health records are important in this respect. And also, the total cost of the deployment of electronic health records is high, as was found out last year through USAID's investment. The total cost of development of Open MRS is $8 million. And this also does not include the cost of additional improvement of the software. And that does also not include the routine maintenance of Open MRS. So this is an expensive tool, but also has a lot of benefits in managing patients' health. Then, why security? Our experience shows us that oftentimes security of information systems is an afterthought. It comes much later when the system is already deployed, many steps ahead after its design. Also, the involvement of patients and their rights in the kind of data that are collected about them also comes much later, as opposed to coming earlier at the design stage of information systems. Also, many of the countries where perhaps many of you are listening from find that the capacity of information system security is growing, is still nascent. And whether you look at the skills or the numbers, we're still falling far short of what would be expected for optimal implementation of information system security. And while that is still happening, there are still many threats as we integrate information systems, and information systems grow from standalone computers to computers and information systems in a networked environment. There are many challenges to do with information security for patients' information. But also we need to recognize that some work has already been done and is already being done at the international level, at the national level, and also at the regional level. For example, the African Union Convention of Cybersecurity and Personal Data Protection of 2014 came up with a broad framework for member states to use in designing their own information system security. In America, there is the HIPAA, the Health Insurance Portability and Accountability Act of 1996. In 2016, there's the General Data Protection Regulation framework for European countries that gives power to the owners of data, the patients or individuals, to see their data, to edit their data, and to know how their data are used, whether in Europe or outside of Europe. And also many countries around the world are coming up with their national regulations for data security. In designing the SOPs that we'll be talking about, we reviewed standard operating, international standard organization guidelines. We looked at the National Institute for Science and Technology guidelines, and we also looked at HIPAA. And what we did was that because these are designed with the high income countries in mind, we had to whittle them down, to adapt them to low and middle income settings so that they make more sense in those environments. And now going into the details now of the tools and the standard operating procedures, and now I invite my colleague Olivia to proceed from here.
Thank you, Sam. So we can go to the next slide. And this is an overview of the assessment process that we put together for the tool. So there's 4 key steps: preparing for the assessment, conducting the assessment, communicating results, and maintaining the assessment. And even though it's kind of looks like there's one particular order, it still follows that circular process that was in the overall ISO and other types of guidelines that you see. Next slide, please. Thank you. Back one. Okay, so the first step, as I mentioned, is preparing for the assessment. So what you want to do in this part is be clear about the purpose of the assessment. Is this an annual review of your security? Are you responding to a particular incident? Maybe there was some loss of data and you really want to understand what happened and what can be done to improve or prevent it from happening again. And then also, agreeing with all your stakeholders on the scope of the assessment. A lot of our electronic health records are moving towards becoming more interoperable, whether it's exchanging data with DHIS2 or with a laboratory information system. It's really easy to expand the scope to a point that may become unmanageable when conducting an assessment. So you have to kind of set clear boundaries, like we're only going to look particularly at the EHR, or we're going to look at the EHR and the data exchange with the laboratory system, whatever it is, but you need to be clear. You may even only look at a subset of your facilities that have the EHR instead of all of them. If you have 100 facilities, maybe it's not possible to look at all those facilities. So that's also another thing you need to be clear about, and all the kinds of assumptions and constraints that come with doing the assessment. You may only have so much time and so much resources to actually conduct it, and it can be quite time consuming. And then think about where you're going to get sources of information, what people you need to speak to, what documents you need to see. In many cases, what we find that's different about conducting assessments in the development space versus what you would do in say the US or another country is you have multiple layers of stakeholders. You have your funder, you may have an implementing partner, you may have a service delivery partner, you may have sub-partners that are all touching on your EHR that may or may not need to be included as part of the assessment. Next slide.
Sorry, there's a delay in getting the slides moving to the next.
Thank you. So step 2 was conducting the assessment, and that has 5 sub-steps. And again, it's not really a linear process, it's more circular. So once you've determined the scope of your assessment and kind of done your initial, this is what we need to look at, you do your preliminary requirements gathering. And then within our toolkit, we have a number of tools. So there's a privacy assessment tool. There's some guidance to making a criticality and sensitivity determination. There's a security controls assessment, and then you also conduct a vulnerability scan. But as you go through each of these steps, you may find that you have to revisit an earlier step because of new information that you've learned as a part of the process. And now I'm going to pass it on to Christina.
Great, thanks, Olivia. So, as Olivia mentioned, the first part of the assessment is to plan for the assessment and prepare. So the first step is the preliminary requirements gathering. So you're using the information from preparing for the assessment to ensure that you have the information that's needed for the scope of the assessment that you determined in the previous step. So making sure you understand, you get the appropriate information about the data that's being collected, the systems that are part of the assessment, and understanding the functions of the EHR that is being assessed. And you'll share this information with your external stakeholders. Similarly, as part of this requirements gathering step, you'll continue to ensure that everyone who is participating in the assessment, the organizations that are involved, as Olivia mentioned, there's many different stakeholders, that everyone agrees kind of on the boundaries of the assessment. So the boundaries, for example, if you're assessing an EHR, could stop at the EHR. It could also stop where if that EHR is exchanging data electronically with other systems, it could go through that interface connection. So making sure that everyone is on the same page about the boundaries of the assessment is important. Next slide, please. Thank you. And so at this point, you would also want to be understanding what we've called implementation scenarios. And this is an important part of the tool that we added later after we had piloted or tested the tool in a country. It was part of, we developed this as part of developing the assessment tool and testing it. we learned that, as Sam mentioned earlier, that the controls and the standards that are in place for security of systems, are can be very intense and in depth for low resource settings. And so we learned that, going through all of these different standards and processes with with our interviewees and with the stakeholders might not make sense based on how the EHR is being implemented in country. So we decided that we wanted to be able to filter out the security controls based on how the electronic health record is being implemented in the country. And so you can see here that for each different implementation scenario, there's a security requirement level. And then each of the controls, which we're going to go through next, the security controls, we've kind of ranked them as, are they for the minimum security, intermediate, or advanced? And so the implementation scenarios for minimum are a facility-based standalone instance of the electronic health record that's either rarely or never connected to the internet. So really, and it's also used for retrospective data entry. So the risks to this system and a security breach are quite low. If it's never connected to the internet, you're not at risk for as much cybersecurity problems. Similarly, if it's used for retrospective data entry, that means that there is backup data available. So the risks, of data loss, while they, it would create a lot of work and challenges, are not as great, because there is, if it's being used for data entry, that means there's also a paper backup. The intermediate level here, so this means that there would be more security requirements, is for, again, a standalone instance, a facility-based standalone instance. And what we mean by facility-based is that the EHR is installed there locally on a server and is being accessed only within that facility. So it might be installed on a local area network, but it is only being accessed and used by computers and devices within that facility. And so this, again, is looking at a standalone instance that might sometimes be connected to the internet. So it might be doing a little bit of perhaps data sharing. And it's being used for point of care, kind of a mix of point of care service delivery and clinical decision making. And fewer data are being captured on paper. So again, as the backups, so then you're thinking, if there's not as much paper backup, then the risks to losing this data are greater, and there's also greater risk to the system if it's being connected to the internet more. So you need more intermediate security level there. And for advanced, this is an EHR that I think most of us maybe many of us think of when we're thinking about electronic health records, or think about as like the ultimate goal of an EHR eventually would be that this electronic health record is connected to the internet frequently, it's doing data exchange. It even could be a networked instance of the electronic health record. So perhaps it's a regional, or national electronic health record. So the server for that and the central database are actually stored outside of the clinic, and the facility is accessing that through an internet wide area network connection. And so in that case, there is a lot of risk, both for cybersecurity and for loss of data, because that data that you're collecting is for more than just your facility. There's likely not paper backups and things of that nature. So as we go through the next few slides, we're going to go through the security controls that are involved in the assessment. You should know that these in our tool that is we'll show the link at the end of the webinar. You can see in more detail for each of the controls, which ones we've ranked as minimum, intermediate, and advanced. So that can help in processing what questions and what you'll need to go over with your stakeholders as part of the assessment process. So yes, and then before getting into the controls, there is the privacy assessment. No, you were right, Sam. So the privacy assessment, is part of, it's the second step, or it's part of the process of conducting the assessment. And this is really looking to understand what information is being captured in your electronic health record. So this looks at, what personally identifiable information is being collected. So is it just is it names, birth dates, addresses, national identifiers. So it really, and then of course, what type of health data is being collected. So this really just aims to get a really good understanding of what information is being collected, and that will inform the criticality assessment, which is on the next slide, I believe. Thank you. So the criticality and sensitivity assessment is another piece of the assessment process, and it looks at making a determination across these three components of sensitivity of the data that's in the system, and making that determination for each of these three components helps you, again, it adds adds to your level of importance for ensuring that you're meeting the security controls for your implementation of your electronic health record. So the three components here are confidentiality, integrity, and availability. So confidentiality is looking at the risks, or it looks at the system's ability to ensure that the data is not disclosed to unauthorized individuals. And it looks at the risks for what would happen if the data that was in that system was disclosed. So again, referring back to the privacy assessment, if you're collecting very sensitive information, you know, about HIV status or other protected statuses, it could make your determination here medium or high. So these are scored. The determinations are low, medium, and high. And so also if there's financial information, for instance, as countries move to collecting insurance information and billing information in the EHRs, the confidentiality and the need to protect that data becomes higher and higher, because the determination for this one is based on whether or not there'll be what level of impact this will have as far as financial and reputation loss. So reputation loss for the organization, reputation loss for the person, and similarly to financial loss. Integrity is looking at examining how the system, you know, what would be the risks of the system's data being changed or not being able to track who's making changes to the system. So this becomes, you know, moves from low to medium to high as you're moving from storing information on paper records and then post-visit transcribing those into an electronic record. It also is looking at if you're using the system for point of care, meaning you're making clinical decisions based on the information in the electronic health record. You know, the integrity of the data becomes more and more important, because you don't want to be making a decision on medications or labs based on incorrect information. And you also want to know who is changing that information. Is it somebody who has the access, the appropriate authorizations to update that information, you know, such as diagnoses. Only certain individuals should be able to update diagnoses and lab results and things like that. And then availability is looking at, you know, what are the risks if the system the data in the system becomes unavailable. And again, this goes from low, medium to high as reliance on the system grows. So similarly, if you have a lot of paper backups, you're collecting data primarily on paper, you know, the risk to having the system go offline is probably low. While it will create a burden of data entry, of having to do retrospective data entry in the future, you know, the risk is low in that you'll have backups there. But as you move to not entering the information on paper and moving more towards electronic entry, you know, availability becomes more important. Similarly, if you're using it for clinical decision making, you know, the availability of having that data is more important. So, next slide, please. So as I mentioned earlier, the security controls. This is, I think, one of the most probably the more time-consuming parts of the assessment is going through the security controls. And this is where you'll be, as part of the assessment process, you'll assess these controls at each facility and conducting interviews with multiple people at each facility. So when we did the test, then we would recommend, you know, when you're doing these interviews to be talking to system users, to system administrators, to the IT, the people who are managing kind of the IT operations and maintenance, because each of them will be able to tell you about different aspects of each of these security controls, and they'll also be able to validate or not validate each other's statements. You know, sometimes you'll find that there is conflicting information, and then you'll need to kind of reconcile that information. So the security controls, there are 7 in the toolkit. There are 17 families. And so we're going to go through each of these 17 families. Within each of those families, there are individual controls. And in the toolkit here, we have a screenshot so you can see kind of how it's set up in the appendix. But we actually set this up so that those who are conducting this assessment have all the information that they need in this Appendix C. So for conducting this part of the assessment. So you'll see that the table is for the control type, which is access control. And then the title, the specific control here is account management. It gives you more detail about what is this control about. And then in the far right column, there's questions, guiding questions to help the interviewer and the assessor actually go through and actually ask about each of these controls. So that we've tried to make this tool as user-friendly as possible. So you're not, you know, you don't have to be an expert in security to be doing this, although we do recommend that the whole assessment process is overseen by somebody who is certified in information security. But the tool is designed so that multiple people with experience in electronic health records and security and information systems can apply the tool. Next slide, please. So just a few key steps on when you're interviewing staff at health facilities. Of course, you know, we're talking about information security. So I think naturally people get a little, you know, can feel like you might be auditing them. And it's really, so you want to make sure that you're reassuring interviewees that this is not an audit and that it's, you know, an assessment to kind of help understand where are you at with the system as a baseline, and then, you know, you can to identify where you can improve. So really just being reassuring and also not asking leading questions. So you can really, a leading question would be, for example, kind of saying like, do you do X, Y, Z, instead of tell me how you do something. So just trying to just give them the space and give your interviewees the space to explain what they do and not feel like they might be doing something wrong or, you know, maybe missing something, you know. And of course there will be things that you know, aren't being done, and it's just reassuring them that this is all part of a process of learning and growing together. So yes, the process can be long and tiring. I'm laughing because Olivia and I had firsthand experience of this. Yeah, it is a very long tool, as you'll see if you look at it, and that is part of what also prompted us to develop those implementation scenarios to kind of cut down on really the questions that need to be asked based on how the system is being implemented. So if your system is one computer in the facility, you know, back in the room of the records where the patient records are stored, and you're doing retrospective data entry, you don't really need to be asking questions about how do you, you know, ensure that your system's connections are encrypted and things like that to other systems if they're just entering data there. So just thinking about the questions that really need to be asked at each facility. And again, it's, you know, you want to interview a variety of system users and IT personnel. Next slide. So now we're going to go through each of those families of security controls, and we'll just kind of go over what is the security control and what are some sample questions that you might ask. Of course, this is not extensive. The tool is online, and you can look at all the questions if you would like. So for access control, this control is really looking at who is able to access the system, what is in place to ensure that only authorized people have access to the system. So looking at things like account management to the electronic health record. So, and also the roles that so everyone has their own account, their own password. Also, what roles do they have within the system? Roles and privileges. So does somebody who's doing data entry just have data entry privileges, or do they also have system developer privileges, and what are the ramifications of that? So some of the questions you might ask are, did you use, you know, a lot of times there's a default password when an EHR is created or someone's account's created. So do you use that password when you first log in, and explain the steps that you took to deactivate it when it was no longer relevant. Some other questions that we asked were, you know, if we were talking to somebody, we would talk to a few different people and ask them what their staff at a facility? What roles do you have in the system? What are you able to do? And then we would actually go in and look, you know, within the settings, using, you know, have it with a system administrator to see what roles that person was actually assigned, to see if those kind of aligned. And sometimes we found that, you know, somebody was just, you know, was really supposed to be doing data entry, but they also had system developer privileges. Oh, next slide. Sorry, I was trying to move the slides, but it's not mine. Okay, so for awareness and training, this is looking at whether, you know, what information that system users are being given about system security. So we ask questions such as, what instructions are you given? You know, we ask users, what instructions are you given about system security? What training have you received about system security? And things like that. Next slide, please. So for audit and accountability, this is looking at the system, the system's ability to generate audit logs, and also the processes and the organizational side of reviewing and using the information in these audit logs. So we ask questions like, when is, you know, does the system provide an audit log of who has logged in and incorrect attempts at login? And then, okay, if there is an audit file, how often is it reviewed? What do you do when you see an issue in the audit log? And things like that. Next slide, please. For certification, accreditation, and security assessments. So this is looking at whether or not the organization has plans and conducts regular security assessments. So it's looking at whether or not the management and the procedures are lining up with security plans. So have you ever conducted a security assessment before? And also looking at how changes to the system's functionality are impacting security of the system. So when you're making changes for functionality, maybe adding a new module to your EHR, is there an analysis done of how this will impact security? And those are the types of questions that we ask there. Next slide, please. Similarly, for configuration management, again, this is looking at kind of what are the baseline configurations for the system? Are they documented? Is it documented what changes are allowed to be made to the system, and who is allowed to make those changes? And what, you know, again, looking at the security, is there a security analysis happening when you're making changes to the baseline system? So some of the questions that we ask here are, does the organization specify certain settings in the system that are used to control security? Are you know, a lot of times perhaps there's one instance of the EHR that's being disseminated across multiple facilities, but then, you know, are there rules for what changes individual facilities can make to the EHR? So those are questions that we ask there, as well as looking at, are there inventories of the devices that are allowed to access the system, and things like that. So now I'm going to turn it over to Olivia to keep going through the security controls.
Okay, so the next control is contingency planning, and here you can see a good example of where those implementation scenarios are important to consider. So if you are using an EHR for retrospective data entry, so it's just a clerk entering data, copying it from paper records or other notes, the need for contingency planning is less severe than if you are in a paperless system, doing point of care data entry and relying on it to look at results and for clinical decision making. So the idea is to planning for events and potential for disrupting system operations. So in the kind of retrospective data entry scenario, it's how long can you go with the system being down, and what do you do with the paper records during that time frame? If it's a point of care, and you need immediate lab results to make decisions about patients, how are you going to get that information while the system's down, whether it's because your internet is down or your electricity is not working, whatever the reason is. So that's why it was important that we really had all these questions kind of contextualized. Next slide. So identification and authentication. So these looks at how technically you identify users versus in other situations, we were talking more about administratively setting up user data. How do you grant access to resources in the system? So if you're interacting with different modules within the EHR, who has access to those modules? What are they allowed to do? You know, and what are the procedures for setting up the authenticators? You know, whether it's you know, you have to change your password every 3 months, and how does it prompt that? How does it lock users out? Those kind of things. Next question. Next slide. So incident response. So this is different from kind of the contingency planning, and it's talking about you have an incident like theft of your server, or you know, some kind of loss of data or loss of confidentiality. So what are the procedures in place to mitigate threat events like that? And do staff know what to do when something like that happens? You know, they arrive at the facility in the morning and there's been a break-in and the server's missing. You know, what are the processes that need to be in place? How do you prepare for that? You know, you don't want to wait till those things happen. You want to have a plan in place to be responsive to threats that might happen in your facility. Next slide. So maintenance. So this is general maintenance for your computer systems, your networking equipment. You know, is the antivirus kept up regularly? Who's responsible for that? When is it performed? How is all of that managed? Is the kind of questions that this control gets to. Next slide. So media protection. So as you can imagine, this one is a big issue because we do see a lot of facilities rely on USB sticks and other media to share data, and also for non-digital media. So, you know, do you have a plan in place for when you print a lost to follow-up report that has patient's PHI? You know, you can make an inference about the diagnosis based on what's on that paper data. So how do you track that media? How do you make sure it's destroyed, and how do you make sure it's used appropriately? Do you block ports so that you know, not just anybody can come stick a USB in, or that the USB doesn't have some kind of malware on it that loads onto the system? So it gets around to all those types of questions. Next control. So physical and environmental protection. So these are to protect the physical space where the server, the networking equipment, and the computers that are used to access the EHR are stored. So, you know, is there limits to who can access that physical space? Is there temperature and humidity controls for the server room? Is the wiring enclosed, and is it kept secure, and so on and so forth. Next slide. So planning, so this looks at, you know, what plans are in place, and a little later on when we talk about the standard operating procedures, you know, there's a listing in there of all the kinds of documents that you should have. And this is usually a really big area where we see facilities and implementing partners don't have a lot of documented information about how to do different types of planning, including the incident response planning, the contingency planning, security assessment planning, like all. So this kind of looks at an overall picture of like, are all those kind of things in place and documented, and also looking at HR issues. Next slide. So personnel security. So, you know, here you kind of want to make sure that the staff that are accessing the computers and the data have been through training, that they understand the risks, that they themselves don't have a history of compromising or sharing data, and that they're, you know, that they have the information they need, that there's steps in place for when somebody leaves, that, you know, you terminate their access to the system. How do you deal with volunteers and outside agencies? You know, a lot, again, because of the multiple layers we see in the development space, where you have implementing partners, you know, regional implementing partners, funders, and other stakeholders who, for whatever reason, might need access to your EHR for a short period of time. what are the policies and procedures in place around ensuring security and ensuring that people understand how to keep the data and information secure. Next slide. So risk assessment. So this is particularly looking at what risks there are to your particular system. You know, is there a risk that somebody's going to hack your system? Is there a risk for your device being stolen or anything like that? And then what are your plans for mitigating those particular risks? So it's really looking at across the scope of all the types of risks for your EHR. So again, you know, might be scenario specific. So, you know, if you have a facility, again, that's just doing retrospective data entry, they're not connected to the internet on a regular basis, and it's just a laptop that's stored in a secure room. You don't really probably need to do like heavy penetration testing or vulnerability testing because by virtue of not being connected to the internet most of the time, it's not really a risk. Whereas if your system is online with internet access at all time, you know, you have to take more of those things into consideration to ensure that there's no unauthorized access or use of the system. Next slide. So system services and acquisition. So, you know, this goes into more, you know, planning and management of security through the software development lifecycle. And this is kind of looking at more like, you know, where did I get this software? How do I know that the way it's designed and developed is secure? You know, have I done my due diligence with the software organization to make sure that everything is kind of up to date? And this can be really challenging because if you're a small IP, you may not have the capacity to really understand where the software is coming from and how it's being managed. Next slide. Oh, Anna, these are your slides actually. So let me turn it over to you.
All right, thank you, Olivia. So I'll just finish up a couple of the final controls. And so another one of these controls is the system and communications protection. And this is just talking about how you plan for the physical and logical controls within your system. So a sample question there would be describe how the EHR or EMR protects the integrity of transmitted data, meaning how does it control data that is being transmitted or at rest, and making sure that it continues to be secure. The integrity of it remains the same as when it was put into the system and is not changed. Next slide, please. Have we moved to the next one? Okay, all right. We'll talk a little bit about the vulnerability scan, which is one of the steps involved in the assessment. And what a vulnerability scan is, it's a type of technical testing used to identify, validate, and assess technical vulnerabilities and assist organizations in understanding and improving their security posture of their systems and networks. So this really is a automated method of actually testing your application while it is before it is installed or as it is in production, to just make sure that it continues to be secure. For the assessment of the Uganda EMR, we actually used an open source software called Ac9. There are a number of tools that can be used. Some are commercially available vulnerability scans that can be very expensive, but there are a number of open source ones as well. And we found that there is a list of these tools on the Open Web Application Security Protection Security Project OWASP website, as well as FedRAMP, which is the federal government's list of approved software as well. Other places that you can find listing of vulnerability scans are like the Gartner quadrant for application testing. So you can look at those to determine the type of security tool that you would like to use, and specifically also to pull up tools that are free and available. So in our vulnerability scan, what we do is that we point the application, this tool at the application, and allow it to scan through all the pieces of the application, identifying things that are wrong with the application. In our case, things like encrypted passwords, things like SQL injection, cross-site scripting, things that can affect the security of the application were identified. And what's good about a vulnerability scan is that it tells you exactly where it is, because it tests every single page and every single piece of the application. Now, vulnerability scan is different from a penetration test, but for our purposes, we thought that a vulnerability scan will be sufficient. So I'll turn it over back to Christina.
Great, thank you, Anna. So throughout the assessment process, it's important to be communicating the results with your stakeholders. So there's kind of two main places where I think about needing to definitely communicate the results. And one is at the facility level. So as part of the assessment, you'll be visiting multiple facilities. And so at each facility, after you've done the privacy assessment and the security controls assessment, it's important to kind of give like a wrap up of just some of the key findings that you found, so that facilities can get some takeaways before you even present that information up to whoever else you're working with on the assessment. So we found it, it was helpful to kind of point out some of the strengths of the facility, also some of the gaps, and give the facilities a chance to talk about, if they had considered doing any of the filling in some of the gaps of the processes, or what some of the challenges that they were facing in implementing some of the controls. And then, of course, as far as communicating the results of the entire assessment, it's important to kind of summarize findings by strengths and gaps by family of security controls. So again, those 17 controls that we just presented, there's a lot of controls within those and a lot of questions within those. And so one way that we found really helpful to summarize that information was kind of to summarize by the strengths and weaknesses within each family of controls. And then the results should also be presented in a way that helps those that the implementing partners and donors understand kind of how to prioritize what they should do next. So the purpose of the assessment and the assessors, depending on who the assessment team are not to say, you must move forward on X, Y, Z, but to kind of help prioritize based on what are some of the higher priority controls versus what are some of the lower ones. But really the organization who is responsible for implementing the EHR will really need to think about what resources and capacity they have available to then start plugging in some of the gaps that are identified by the assessment. Next slide, please. And then once you've done the assessment at least one time as kind of a baseline, it's important to continue to maintain the assessment. So for security assessments, they're really only good as the day that you can conduct them. So we all know that systems are constantly changing, processes are constantly changing. So the information that you collect may become invalid the next day if a new procedure is introduced and things like that. So it's important to just continue to maintain the assessment. So continue to review all of your controls, review the processes that you have in place to see, okay, what are we changing, and constantly be updating the assessment so that the organization and those who are responsible for implementing the electronic record have a good sense of where they are in their security plans. And so action planning, should be done at the end of the assessment, but then continually, there should be review the assessment, continue to action plan, review the assessment, continue to action plan based on how the technology landscape is changing. Next slide, please. Oh, and so I'm going to turn it back over to Olivia to talk about the standing operating procedures that we developed under this activity.
Okay. So the assessment tool itself is really for when you have your EHR established, you're going and doing annual assessments, or as I said earlier, in response to an incident. But, we do find, a lot of implementing partners don't really have kind of security planning in place. And so in order to get them prepared for that, we put these kind of standard operating procedures that were based on international best practices, but also looking at those implementation scenarios that we talked about earlier. So it kind of gives an overview of in the document, the overview of the different implementation scenarios, what you need to do to develop a security plan, a checklist of administrative, managerial, and technical safeguards that you need, and then different resources. So kind of the more of the robust tools that are available out there. And I mentioned that we've adapted most of this guidance from the NIST standards, NIST 853. And part of the reason we selected the NIST standards is because, there are some organizations that really do have sophisticated, interconnected EHRs in place, and they may need to look at the higher level security tools that we didn't include in our tool. But also because those standards are kind of freely available, you can find them and look in more detail. I noticed there was a lot of questions about, mobile health tools. So those broader tools can be adapted to anything, and they're supposed to kind of take all those considerations into place in looking at different types of information systems, whereas, we focused on EHRs, but there is a lot of freely available stuff out there, and we map to that again because some of the ISO and other security tools are behind paywalls that people can't get access to, and if you cross-reference them, they really all kind of cover the same thing. Next slide. So one of the things we go through in the standard operating procedures is just how to have a security management process. So the first step is, being aware of the security landscape. So again, this is like kind of an overview of internationally, what are the best practices in the country where you're operating, what laws are in place, and what do you need to do to adjust for those laws. So one example was in Uganda when we did an assessment there. They had just passed a data privacy and protection law that required facilities to make patients aware that their data was stored in an EHR and that there was a process in place for how they could have that data changed if they didn't agree with what was in the system about them. And because when we got there in January 2020, that law had just passed, there wasn't really clear plans of how facilities were going to adapt to that, and in some cases, people hadn't understood or how that they were responsible for making that information available. So there's passing a law, and then there's how do we make this actionable. I think we went through the same thing here in the US when HIPAA was put in place, and so it's knowing what those things are and how to react to them. Then designating a security team is the next step. So who's going to be responsible for EHR security? When you go to a lot of facilities, it's the M&E officers in charge of the EHR or EMR, and that person may not have an understanding of technical safeguards or other kind of safeguards. So you may need to bring in outside guidance to help facilitate security processes. Then step 3, as I mentioned, documentation of security processes is a big gap that we found. So you need to have a contingency plan, a security plan, a risk assessment plan, and all those things need to be documented so everybody knows what they're supposed to do. There's something to refer to. You may need it for legal protection, because if you have an incident and your government comes and say, okay, you lost this data and we're going to penalize you because you compromised these patient's confidentiality, and then on top of that you have no documented way of securing your data, you may be even more penalized. So all of those things have to kind of be documented and stored. Conducting a security assessment, so you can use the tool that we just presented to do that, but again, it's something that needs to be maintained and ongoing, and You know, you have documented procedures about when you do them. Okay, we do it annually at all our sites. We do it occasionally at our high volume sites with more frequency. We do it in response to any kind of incident. And again, you know, do you want to bring in outside assessors so that the data collection is a little unbiased, or whatever you need to do? And then actually implementing the action plan, you know, this requires resources and funding and personnel and money. You need to have buy-in from your management and whoever else is responsible. And then again, it's always continuous security planning and monitoring. So when you conduct an assessment, it's really only valid the day you conduct it, because any changes to your system means it, you know, your security assessment is no longer valid. You hired new people who weren't trained, you started to do biometric scanning, whatever it is, you know, you need to reassess, and there needs to be robust audit logs, so you're monitoring your system constantly, and somebody's designated to do that, so on. So it kind of gives some guidance to all those steps so organizations can start to prepare themselves. Next slide. So some of the lessons we learned, and there's probably many more than this, not only in the process of developing the tool and testing it, but just in part of continuous conversations. So the big thing was with the implementation scenarios, you know, we don't want to overburden small facilities by trying to put in security controls that are probably not going to be very relevant to them. If there's such a low risk of you know, being hacked, you don't need to do vulnerability testing and penetration testing. You know, again, it's cumbersome and time consuming, and you can rely on your people controls of making sure your staff is trained and understands security, and that'll cover 90% of the problems that you'll probably have. As I mentioned earlier, some of the international tools that are available were designed, you know, not for the kind of common multi-stakeholder levels that we see. So, you know, if a hospital in the US conducts their security assessment, it's very internal to the organization. Whereas if, you know, I'm conducting it with my IP, you know, you might have to bring in multiple stakeholders, and you want to be sensitive to, like, you know, this isn't an audit, it's an assessment. And this is to help you be more secure. It's not to penalize you. It's not to embarrass you. It's, you know, it's to make sure that we are doing the best we can for the people that we're serving to keep their data and information secure and confidential. And one of the links that we'll provide on the next slide, you can see a screenshot here, is one of the assessments we did in Uganda. And so you can see how it kind of plays out and how you communicate results and reports and so on. Next slide. So this has the links to our tools, the SOP, the assessment tools that we presented in the beginning, and then the report if you want to take a look at one example. And then, you know, if anybody wants to reach out to me or my other team members to ask questions after the presentation, they can, but we can open it up to Q&A now.
Great. And as we transition into the Q&A, just a huge thank you to our colleagues at ICF for sharing this presentation with us. We've received wonderful questions, and we have plenty of time to answer many of them. If you have questions, you can put them into the Q&A. And we'll get started with ICF team. If you can discuss in the definition for terminology that you use for this, for EHR, and why you presented this as an assessment tool for EHR security as opposed to, for example, EMR security.
So I can take that one. So I think we are presenting a security assessment tool for a tool that holds patient records, which can be an EMR or an EHR. I think that in this case, those two can be interchangeable because a lot of the things that we've presented here applicable to both. A good example of this is in Uganda. The Data Protection Act states that an EHR or a medical record or any medical records that are held by somebody, by an organization, should allow the owners of the records to actually access it and correct any misinformation in there. Now that is something that is applicable to an EMR and an EHR. So these are security practices that cover both of those. And the operation of an EMR or an operation of an EHR does not negate any of those. Also, when you do a risk assessment, you look at what kind of information you have. So if you have very little information, personal information, protected health information, that means that the level of security is a bit lower, or the things that you have to do is a bit lower, because if a breach happens, not much is revealed. So that helps you to understand how to go about doing your assessment. So that really speaks to if it's an EMR or an EHR. So these are kind of those overarching ideas that affect any kind of system that is actually holding electronic health record of people.
Thank you, Anna. Olivia alluded to this in one of her recent slides about assembling the security team. We have a question from who should take care of security? Is it IT personnel or is it an informatics team?
So I think that probably really depends on your organization. As I mentioned, it's a time-consuming activity, and you probably actually, depending on how big your organization is, how many installations you have, you may need dedicated personnel or mostly dedicated personnel. You want somebody who has understanding of the legal space, the administrative kind of understanding of within your organization. So it could be an IT person, it could be a health informatics person, it could be an M&E person. It's somebody who needs to have buy-in and voice with your leadership, because as I mentioned, it's time consuming, it's and it's not, it needs really like organizational support in a lot of ways. One of the things we recommended, whether whoever one of those people that it turns out to be, is that at some point, or at least at the beginning, you might want to bring in a specialist, a security specialist, and we gave some recommendations on how to find a security specialist in country. And I think as we see more interoperability and larger systems and bigger interconnected health information systems, you're going to find more security professionals in country that can aid in this process. But I don't think there's a one size fits all of who the person should be. I think if you find a champion for security within your organization, then that's probably the person that you should go with.
Thanks, Olivia. Speaking of increasing interoperability between systems, we received a question about what the security approach is for interoperability between systems.
So, Anna, do you want to take that one? Or
could you repeat the question? Sorry.
Sure, Anna. And we can always ask our question submitter to submit additional detail if needed. But our questioner asked, what would the security approach be for interoperability between systems?
Okay, thank you, Lauren. When you're talking about interoperable systems, you start to talk about data sharing agreements. How is data flowing from one system to another? When you hand off data from one system to another, it becomes the responsibility of the receiving system. But that doesn't mean that the system that provided that data just hands that off. It is it is also part of the responsibility to make sure that they are handling that data in the right way. So you start to talk about data sharing agreements. Also, when in interoperability, that means that maybe you're communicating your data via the internet or via some other kind of network. So you start thinking about data transmission. And so in transmission, we start looking at encryption. How are we encrypting the data? How are we making sure that if somebody intercepts it, they cannot decrypt it, or and then also as it is being transported, it actually gets to the system that it's supposed to be going to, the destination, and not to the wrong system. So things like that. So the security becomes much wider when you start talking about interconnections of systems as opposed to a standalone system.
Thank you. And if I may also add to what Anna has said, the questioner asked about the approach, and interoperability is premised on standards, and therefore at the starting point discussing interoperability of information systems, there is need to discuss about the standards for for information security, and if those become part of the implementation strategy of interoperability, then you're setting yourself for the right approach to assure information system security.
Sam, Anna, thank you. We received a few questions about security when working with systems on mobile devices. How could these assessments help address inherent risks pertinent to mobile devices?
So I think the tool generally can also apply for mobile tools. There are, when we designed this tool, again, because it was specifically for an EHR, the language all around it, so, it repeatedly says EHR and kind of refers to those specific things, but you could use this tool, or again, the more fuller ISO tool if needed. I think there are probably some things you want to look at with a mobile device that you wouldn't consider with something we expect to be more stationary, like, even though I guess a laptop is technically mobile in some ways, but like geofencing and other things are kind of things that you want to think about with a mobile tool. But I think for the most part, the questions will apply, because if you're collecting personal health data, all of the privacy tool applies, the security tools. But I think you want to get more into questions about what people do with their device, how, is it stored somewhere safely, or people taking it home, and we don't dig into those questions as much with the EHR, but it's definitely something you want to consider more. And if people are using personal devices to access the system rather than organizational supply devices, you really need to have policies and considerations around that. That'll be critical to ensuring security, especially if they're sharing the device or anything like that. So it's there's some additional considerations, but I mean, you could definitely use this tool as a starting point for mobile applications.
And one of our observations we made in previous attempts to mobile information security for mobile devices is the network in which the mobile device is connected, because it's mobile, and there are many hotspots out there. Some of them are insecure. We found that there is need to investigate further on the type of networks that are much more secure to ensure the security of data that is passed between the mobile and the central information system.
I think also to add to what Olivia and Sam have mentioned, some aspects of the 17 families of security controls begin to come into play really heavily. For example, personnel security, you have to be able to screen the people that you are actually giving these devices to. Also, training and awareness. What do they do with that device if they're taking it home? Are they using it for other activities and things like that? Also, making sure that they are unable to maybe download certain things onto the onto the mobile device that would then compromise the application that is holding this electronic health information. So you start to look at a wider range of security controls. And again, going back to your risk assessment, because your risk assessment will tell you that with a mobile device, it can get lost, it can get stolen, and therefore, what do you need to do? Are you going to if it gets reported as stolen, do you then try to find it, or do you make sure that you send some code to make sure that it's bricked, which means that it gets wiped out completely, things like that. So you have to take those additional measures into consideration.
Thank you, ICF team, and great question from one of our participants about mobile devices. We have about 15 minutes left, and I will try to get through all of these questions. The next one is in two parts. In terms of tools that are already existing and those which are in development or perhaps being planned, could this approach fit both of those scenarios? And on a similar note, is there a way to use this tool proactively for developers and implementers to adhere to while developing and implementing secure EHR?
Typically when you're developing systems, the point at which you would run a security scan is, when you're ready to move it into production. So you would, if you had new features, you would run the security tool scan again on the entire application so that it can determine whether there are any updates, any updated vulnerabilities, because as you know, these tools are updated regularly with the most up-to-date security threats that are out there. So before you actually update something in production, you should run a scan, and then the scan will tell you what the high, medium, and low security vulnerabilities have been detected, and then you would be able to then go and prioritize correcting those. But then also periodically when it's in production, maybe during some downtime, it would be useful to also run the vulnerability scan. Obviously, this would be best in downtime when the system is not being used very heavily, because a security scan can take up a lot of bandwidth and time, and can sometimes make the application unusable at a particular time. And then getting those results and then going back and planning to patch those vulnerabilities. So this is an ongoing thing, because as of today, we have certain security threats and vulnerabilities. Tomorrow, there will be some additional ones. So they might be ones that have been fixed today, but then we have a number of additional ones tomorrow. So it's an ongoing thing. So security is not a one-time aspect that you look at. It's an ongoing assessment and an ongoing way of determining where you are and correcting those issues.
And Anna, just to add to that, I think the tool, in a little other parts of the tool aside from the vulnerability scan piece, which Anna addressed, can be used. So there's two tools, first of all, that we talked about here. We have the assessment tool, the security assessment tool, and then we have the standard operating procedures. And I think both could be used. They're both obviously designed to be used in production environment, but also you can use them in developing an EHR as far as looking at what functionality is needed in your system to ensure functionality. So there are some parts, there are what we call the technical controls. So there's the management controls, operational controls, and then there's the technical controls. So those are like what features within the system need to be there to ensure that the system will provide security, such as there needs to be the ability to have audit logs of certain information, and there needs to be the ability to assign access roles and privileges. And so that needs to be, those functionalities need to be in the system. But then you also need to be using these tools and looking at planning for your implementation. What policies and procedures will you need in place to ensure security? So it's not just, is your system secure, but it's the implementation and the context in which it's being implemented is also very important. So those are the management operational controls. So yes, both these tools can be used in development and in production. And the standard operating procedures that Olivia talked about at the end, I think might be a good place to start as far as just, you know, if you're just starting, like, what should our security plan be, or how should we even get started with security plan? I might recommend looking at the standard operating procedures document that she mentioned that we linked to kind of get started. And that will link you also back to the larger assessment tool.
So maybe just to add one more thing about development. Many systems are, you know, as you know, they are out there in production. Maybe they haven't been, they haven't taken into consideration security. So when you're trying to make updates, I think it would be useful to go back and look at some of the software methodologies like frameworks. And frameworks help to develop software in a way that adheres to security protocols. For example, if we have a framework like the Model View Controller, which is really like a separation of duties, which is one of the key pieces in developing of software. You want to be able to separate the user interface from the database and be able to secure the database connection so that you don't have SQL injection and those kinds of things. So as you update your software, it would be good to go back and look at standard practices for frameworks or software frameworks and begin to incorporate them into your systems.
Thanks very much. We'll get through a few more questions. One being, how do you assess risk to determine if security measures are required?
So maybe the most direct answer is that you should assume that your system is vulnerable and the security measures are required. Because there is no system in the world that is completely secure. Security is an ongoing endeavor. So you should assume that it is not secure and continue to work to mitigate security threats to your system.
Mm-hmm. Yeah, and some of the tools, some of the pieces of the assessment tool get at assessing risk. Like we mentioned, the criticality and sensitivity assessment looks at the risks to confidentiality, integrity, and availability. So that might help you start to think about the risks, but there are other risk assessment tools available as well.
Thank you. For national programs, how would you structure such assessments? Do you recommend the adoption of security review boards?
Security review boards, go a long way into this idea of governance. I think there was a question about who should be in charge of security. First of all, security seems to get to be done at the very end, and that's also because it is not considered part of the management structure. So that there is nobody at high level of the organization that actually takes care of this or is a champion for this. Just thinking through a governance process, a review board is definitely a good addition, but it's also reactive. You want to be, while you think about security, you need to be more proactive. So looking at security from before it actually, something bad happens. And so just making sure that you have that organizational capability and organizational infrastructure to do that.
Thanks, Anna. I think we have one more about the assessment and processes in general, related to the previous question. And is that how often the assessment should take place, for example, in a year?
So I have worked on systems that get assessed every year. Sometimes if you're doing some official certification and accreditation, that information is done every 3 years. But this is something that you should do periodically, so that you continually understand the security posture of your system. For example, if you have something in production, maybe scanning it every year would be good, but also performing reviews on a quarterly basis to identify any potential security threats would also be good.
Yeah, and to add to Anna, perhaps one of the things to consider is when we are reviewing data quality, data availability is one of the qualities of data. And so if you do not have that data in the first place, then the quality of data is not as good as you'd like. And so there has been suggestions to embed at some level of information or data security into the already established data quality assessment rounds, and such that there can be additional questions asked about the data and the security of information during those rounds, awaiting a more thorough data and information system security assessments.
Thank you both. We'll get through just a few more quick questions. One being if there's a scoring system to score the 17 families so that there is a benchmark to measure improvement.
That one. So the tool does have a scoring system, a proposed kind of scoring method for those. It's not really meant to be a quantitative score, but there's scores 1 through 4, I believe. And those just kind of represent levels of implementation of the control. So is the control, are people kind of somewhat implementing it? Is there some documentation around it? Or is it fully documented and implemented? We found, I mean, we've also worked on, our team has worked on developing some maturity models, looking at health information systems. And we found, the scores are good for benchmarking, but they also can be really intimidating and cause people to not necessarily want to be, I don't want to say as honest as possible, but just they can be intimidating. And so, you may choose to not use the scores there. We didn't do that when we tested it. In Uganda, we really just focused on qualitatively focusing on highlighting what were the strengths and weaknesses, and then, prioritizing from there. But there is a proposed scoring method if that's right for your context.
Christina, thank you. We don't have time to get through all of our questions, but we've received wonderful questions from our participants. For those of you that have questions specifically about the tools, what the tools include, our colleagues from ICF have shared the links that I just put into the chat, both to the assessment tool as well as to the standard operating procedures. We do unfortunately need to wrap up, but to the ICF team, we all like to thank you for such a comprehensive presentation and a wonderful Q&A session as well. And to our participants for your participation and wonderful questions. We will be sending out or we will be posting the recording, including the visual aids, so the slides part of the recording, to our website. Our website is also where you can sign up for our listserv if you received this invitation perhaps from a colleague and you want to receive these webinars directly. I've put the link into the chat as well. On our website, you can also find information about our call for abstracts for the Global Digital Health Forum, which will take place in December 2020. Our call for abstracts is open until July 2nd, and this year's theme is Digital Health, Making It Work for Everyone. On our website, you can also find tips brought together by the Network of Networks some of the digital health regional networks for successful abstract submission. We thank everyone for their time and hope you have a great rest of your day. Especially thank you again to our colleagues from ICF.
Thank you, everybody. Thanks, Lauren and Steve.
Thank you, everyone.
Thanks. Bye-bye.